Welcome, everybody, and thank you for taking the time to attend our grand rounds. We are super excited to have you and super grateful. And I know most of you that are on here, I don't know the one Leonard, Mr. Leonard, that's on here. So I'm going to tell you just a little bit about our goals with Science Alliance and Science to the Station and what we're trying to achieve here, which is a way for people that are engaged and interested and involved in the health and wellness avenues for the fire service and how we can try to get science into practice. That's really our entire goal, and giving access to boots on the ground with the people that do the work and find the research opportunities and have the knowledge and help the forward momentum of health and wellness in the fire service. So we're super grateful to have you here and super excited for this opportunity. We are having our first annual conference and we're super excited about that. We are working with FDSOA and Fiero and FRCE, and we are doing a week-long health and wellness conference in Florida. So come one, come all. We are going to be at St. Pete's Beach in Florida starting January 16th all the way through the 20th. And Fiero, FDSOA, Science Alliance or Science to the Station, and FRCE are going to have a continuous week focused on firefighter health and wellness. And we are super excited for that opportunity and to be a part of that, because it's about dang time that health and wellness is a priority in the fire service. So we're very happy. I am going to introduce our two wonderful speakers and wealth of knowledge. And so both of you ladies, thank you so much for taking the time today to help us get some great information out. I'm going to introduce Alesia first. Alesia Jung is an NIEHS T32. Don't know what it means, but I'm still very impressed. Postdoctoral fellow at the University of Arizona. She got her Ph.D. in epidemiology after working with Dr. Burgess on reported adverse reproductive outcomes among female firefighters. She works with us at the Firefighter Cancer Cohort Research Study Group, and we're super excited. Several firefighter studies focusing on cancer, PFAS exposures, and health of women firefighters. Currently, she is studying how epigenetic changes can help us understand the biological mechanisms linking firefighter exposures to cancer and other diseases in the fire service. So Alesia, thank you so much for taking the time to do this. And then Dr. Brittany Hollerbach is an associate scientist and deputy director at the Center for Fire Rescue and EMS Health Research, part of NDRI USA. She has extensive experience working with fire service on a number of federally funded studies. She is the principal investigator on a recent FEMA-funded study examining perceptions of protective strategies for COVID-19. She is also working on two studies examining the health of women firefighters. Dr. Hollerbach has an interest in firefighter health in general and female firefighter health because she has been a former female firefighter. And so thank you both for sharing your time and your knowledge. And if anybody has questions, please enter them into the Q&A or into the chat, and I will be monitoring them both. My name is Kepra Jack, and I do health and wellness and occupational medicine in the fire service. And I am one of the board members on Science Alliance. So thanks for being here, everybody. Have at it, ladies.
All right, so I think I'm up first. So I'll go ahead and share my screen. All right. So thanks for joining us today, everyone. Can I start my video now? Yeah. Okay, anyways. So Brittany and I are kind of splitting this session. And I'll be focusing on what we know about reproductive health outcomes in women firefighters. There we go. All right, so just to give everyone a background, I know a lot of us know a little bit about this topic, but just to get everyone on the same page. A lot of adverse reproductive outcomes share common risk factors in both men and women, where we know a lot about things like social, personal, economic, or behavioral characteristics that can increase your risk for these outcomes. But what we don't know a lot about are what environmental and occupational exposures can do for your risk. Some of the research that has been published has identified that environmental exposures to things such as increased ambient temperatures, stress, air pollution, and wildfire smoke can increase risk in men and women for certain reproductive and adverse birth outcomes, as well as shift work. All right, so next in my talk, I'll focus on some of my research that I've done looking at self-reported miscarriage and preterm birth. So a miscarriage is a spontaneous pregnancy loss that occurs before gestational week 20. Most of them do occur within the first trimester of pregnancy, and a little less than half are due to chromosomal abnormalities. It is the most common adverse birth outcome, and it's estimated that 10 to 20% of all clinically recognized pregnancies will end in a miscarriage. Miscarriages have a lot of social and economic burdens, including economic consequences, psychological consequences, and future health consequences for the mother, including obstetric complications in future pregnancies, as well as perhaps increasing their risk for other long-term health conditions. So a preterm birth, on the other hand, is a live birth that occurs before gestational week 37. In 2010, there were about 15 million preterm births that occurred worldwide, about 11% of all live births. And in the US, that number is a little lower, it's at 10%. Preterm birth is actually the leading cause of infant mortality, and it's also associated with morbidities in the children later in life, including neurologic disabilities or developmental delays, and potentially metabolic syndrome and cardiovascular disease in adults. And there's also a significant economic burden. The average preterm birth will cost about $65,000. And there's also an increased amount of money that will need to be spent towards medical care. So there are currently 2 previous studies that have focused on reproductive outcomes in US women firefighters. Both of them were led by Dr. Sarah Janke of NDRI USA. The first was more of an exploratory study where they wanted to obtain preliminary data on maternal and child health and pregnancy outcomes among career firefighters. And then a later larger study that sought to kind of expand the participants, so both career and volunteer firefighters were allowed to participate, and they collected data on the work environment, health, and perceived experiences. And it was this study that I actually did most of my dissertation work on, which I'll be discussing right now. So when we talk about miscarriage and preterm birth prevalence in firefighters, from Dr. Janke's earlier study, it was estimated that 27% of all pregnancies resulted in a miscarriage. And for context, they compared it to 2 other populations, one a more general US population where the prevalence was 10%, and a smaller kind of medical record-based study where the prevalence was about 12.5%. Later, I was able to look at risk factors for this prevalence, and we found that firefighters were 2.33 times more likely to report that their most recent pregnancy resulted in a miscarriage compared to an external group of non-firefighters. Similar trends were seen in preterm birth, where there is an elevated prevalence observed among firefighters. And when we were able to compare, indirectly compare with a group of non-firefighters, they were about 1.5 times more likely to report that their most recent pregnancy ended in a preterm birth compared to non-firefighters. We also observed that volunteers had an increased risk for miscarriages and preterm births, and that this association was greatest among wildland and WUI firefighters. So I'm going to explain this graph to you, and then I'll show you the one for preterm birth. Here, at this line drawn across 1 is the reference value. So when we compare volunteer firefighters to career firefighters, we can see that their risk is elevated. And when you further stratify and look at structural versus wildland and WUI, the risk in wildland and WUI firefighters is 2.53 compared to structural firefighters, the risk is 1.42. And this trend carried over when we looked at the risk of preterm birth, where it was elevated in volunteers compared to career firefighters, and the greatest risk was seen among wildland and WUI firefighters. We also identified that though whether or not a firefighter restricted their work during pregnancy wasn't significantly associated with preterm birth risk, the timing of when they restricted work did matter. Women who started their work restrictions during the 2nd trimester had 0.6 times the risk of having a preterm birth compared to those who started either later in the 3rd trimester or didn't restrict at all. And this actually supports other studies that have looked at exposures to air pollution and non-occupational wildfire smoke among pregnant women, where they identified that these women had this, seemed to have this critical exposure period during pregnancy, where exposures to air pollution and wildfire smoke were associated with the highest risk of having a preterm birth. The table on the slide is pulled from one of those other studies, where I think this was the cigarette smoke. This one was looking at cigarette smoke, where we can see that in the 2nd trimester, the blue dot, exposure to smoke had the greatest risk of increasing exposure during the 2nd trimester was associated with the greatest increase in risk for preterm birth. However, we still need to collect more information on the types of restrictions that these women took, and other details about work restriction and exposures to establish temporality between exposures and restriction to better inform department policies. So the key messages here are that firefighters are more likely to report a miscarriage or preterm birth than the general population, and for some understudied groups, including volunteers and wildland and WUI firefighters, the risk seems to be even greater. The timing of pregnancy work restrictions when they're started can be important, and work restriction by the 2nd trimester may reduce the risk of having a preterm birth. However, future research needs to focus on enrolling more women from these understudied groups so we can understand what's driving the differences that we're observing, as well as collect more information about pregnancies and work restrictions. Okay, so the next topic I'll focus on is what we know now about female fertility and infertility in firefighters. So infertility is generally defined as the inability to become pregnant after 12 months of regular intercourse without the use of contraceptives. It can be couple specific. So, though a man and a woman may be unable to conceive together, they could go on to successfully conceive with other partners, perhaps. And it can also be multifactorial, meaning there are multiple causes. For women, infertility is usually the disruption of some part of the female reproductive processes, at some point, including during ovulation, fertilization, or implantation. Common diagnoses for women are listed here. Note that one of the official diagnoses for women can be male partner factors. And 48.5 million couples are affected by infertility worldwide. A previous study by the US National Health and Nutrition Examination Study estimates that about 12.5% of US women have experienced infertility in the past. So among firefighters, what we found is that 30% of the women surveyed reported previously experiencing infertility versus, again, the 12.5% reported by US women. And we also identified that a more extensive history working in the fire service was associated with a modest increased risk of infertility, though it was statistically insignificant. And this was adjusted for age, since your career in the fire service and your age are very highly correlated. Some other points that we found were that women firefighters who had experienced infertility, 80% of them had sought help from a medical provider, which is it's on par with national estimates. Over half had utilized fertility treatments. Although this was much lower, the utilization rate among firefighters, regardless of infertility, was lower. And we identified that volunteers compared to careers and wildland or WUI firefighters compared to structural firefighters were much less likely to utilize IVF or IUI, which probably has to do because those types of treatments are pretty expensive and cost prohibitive. All right, we also have some studies ongoing about anti-Müllerian hormone, which is secreted by the granulosa cells of ovarian follicles, and it's a clinical marker of ovarian reserve, meaning kind of the reproductive potential of ovaries. AMH levels peak around age 25 in women, and then after which they begin to decline, which mirrors the decline that we see in the number of developing eggs in ovaries. AMH is strongly associated with female fertility, age at menopause, and some studies potentially link it with miscarriage and preterm birth risk. It's also been noted to be a potential biomarker for other environmental exposures like inhaled toxicants as well as stress. And so we did a smaller study where we compared AMH levels in firefighters to non-firefighters, where we collected dried blood spots from participants. This was also through Sarah and Brittany's study, where we found that the average AMH levels from these dried blood spots were lower in firefighters, 33% lower, compared to non-firefighters after adjustment for age and BMI. This difference is similar to what other studies have reported when they've looked at smokers and non-smokers. However, we didn't see any associations with other occupational factors like years of service, number of fires, gear fit, or wildland firefighting. But studies with larger sample sizes and repeated sampling over time will really help us kind of delve into what could be driving this discrepancy. So key messages: infertility reported by women firefighters seems to be greater than that of US women, and the risk of infertility appears to increase with the length of your career in the fire service, independent of age. Also, AMH could be a very useful reproductive biomarker of exposure among women firefighters, but larger and longer studies are needed. Finally, this is a analysis where we examined polybrominated diphenyl ethers in breast milk collected from women. The study began several years ago. It's taken a while to kind of collect samples and do the analysis. We're in the process of writing up the manuscript. So here's a sneak peek of our results. First of all, why polybrominated diphenyl ethers? So it's a chemical, or it's a group of chemicals that dissolves very easily in fat, so it can accumulate in breast tissue and breast milk. There aren't any definitive health effects, but it may affect neurodevelopment in children. It's also very widely used to manufacture consumer products because of its flame retardant nature. So it's found in things like plastics, textiles, foams, electronic casings, circuitry, things that you would commonly find at a structural fire. Most people in the US have some exposure to PBDEs, and for them, the primary route of exposure is through ingestion of contaminated dust indoors. But obviously for firefighters, what we're concerned about is when these products combust and then they're delivered onto surfaces and in the air. So breastfeeding is associated with many benefits, right? Nutrition, protection against diseases, etc. But it's also a potential route of exposure for environmental contaminants. Other studies have detected it in high levels, have detected things like heavy metals, PFAS, and PBDEs in other populations. So the concern is that, of course, women firefighters may be exposed to elevated concentrations of these contaminants during fire suppression, and then subsequently transfer them to their breastfeeding children. So what did the study do? Well, we enrolled 21 breastfeeding firefighters, which is a small but very powerful number because, well, it's a small but very significant number because I think it's the largest group of breastfeeding firefighters in any study ever to date, as well as 10 non-firefighters. We had them complete surveys at the time they enrolled. And for firefighters, they also completed an additional survey after a fire exposure. And then we had them pump and then ship breast milk samples to the University of Arizona, where we analyzed them. For firefighters, they were asked to provide samples 2, 8, 24, 48, and 72 hours post-fire exposure. So we could potentially track any changes in the levels after the exposure. So overall, what we found is that PBDEs and AHR response, which is a measure of toxicity, in the firefighter breast milk didn't differ compared to non-firefighters when we compared their baseline samples. And then among firefighters, PBDEs and AHR response didn't significantly change when we compared the pre versus post levels, as well as over the 72-hour post-fire period. However, there is important context that I want to point out where we did only look at one group of toxins and one measure of toxicity, and others should definitely be considered. We also had a limited ability to detect changes in levels and the toxicity due to the statistically small group of women that we looked at. So we only had the power to detect a change in at least 50%. So if anything occurred that was lower than 50%, we're not certain that we were able to we wouldn't be able to identify it. Also, we weren't able to really characterize their exposures at the fire very well. So there could be differences by the activities they did at the fire, the time they spent on overhaul or used PPE. And there also could be cumulative exposures after multiple fires. We did only assess the samples from one fire. So if things accumulated over time, it would be interesting to retest. Also, it's still unknown what levels of PBDEs the infants may actually be ingesting from the breast milk. because we didn't collect any samples from the infants. So takeaway messages here are that breast milk does have many clearly defined benefits compared to infant formula. However, potential environmental exposure should still be considered. Firefighting may be associated with an increased risk of adverse maternal and child health outcomes, like I've discussed previously, but the mechanisms are not yet understood. And finally, this was a unique study of breast milk extracts from firefighters before and after a fire exposure. However, more information is needed to support breastfeeding guidelines and protocols. And at this moment, there isn't any clear evidence that could help us inform any pump and dump recommendations. Okay. Acknowledgements to colleagues at the University of Arizona and DRI USA and Women in Fire, as well as a thank you slide. All right.
Thank you, Alesia. Great job. I don't have any questions at this time, and I will keep monitoring.
All right.
Awesome. Thanks, Kep. I will go ahead and share my slides. I also want to apologize to everyone because apparently only my video is able to be shown. So I'm so sorry, guys, that you can't see the lovely faces of Alesia and Kepra. So, can you guys see the notes or the presenter view? Do I need to change it?
I'm seeing the notes.
Okay.
Me too, notes.
How about now?
Okay. Yeah,
that's better?
Yeah.
Yay. All right, cool. So I will continue kind of from where Alesia left off. As Kepper said, my name is Brittany Hollerbeck. I'm a deputy director and associate scientist at NDRI USA, former firefighter. So the fire service is very near and dear to my heart. And studying women and reproductive health outcomes is really, really important. And, you know, we're going to talk a little bit about women and men today. The impacts of firefighting can affect both parties here. So, you know, we'll start out by saying that firefighting is not great for your health. You start with an average firefighter. I don't know why this particular firefighter seems to have the Captain Morgan pose going on, but nonetheless, we'll take this firefighter for our average recruit. And most recruits don't have like 4 or 5 stripes like he has, but regardless. So we'll take our average firefighter, right? And then we add in poor sleep quality and the impact of shift work and the toxic environment that firefighters are exposed to on a regular basis and the physiologic response to emergency situations. And then, oh my gosh, pregnancy on top of all that. And then you add the heavy weight of gear as well as the chemicals that are in gear or the chemicals that may remain in your gear post-fire, and the toxic soup that firefighters are constantly exposed to. It adds up to quite a lot, right? So then we question, like, what's going on with reproductive health? And like I said, you know, I think a lot of folks focus on the reproductive health of the mother, and that's where my brain initially goes as well when we talk about reproductive health. But it definitely takes 2 to tango, and Alesia mentioned that there can be some male factor infertility as well when you're talking to couples who are having trouble conceiving, right? It's not always female factor infertility, it can be male factor infertility as well. So I'll cover a little bit of both. Alesia talked a little bit about how we have some previous studies, and one of them was qualitative, where we went and did surveys of women in the fire service. And when they found out that we were doing research specific to women in the fire service, oh my gosh, the response was amazing. And I think when we started out, we thought, God, I don't even know, like, I think it's relevant, but, you know, is there even enough women to study? And Alesia mentioned how difficult it was to get samples of breast milk from women in the fire service because women represent such a small proportion of the fire service. And then women who are breastfeeding in the fire service is even smaller, right? So it's so hard to do this research, but it's so necessary. So these are just some of the quotes that we have heard over time. People are so excited. For example, the middle quote, I've collected lots of advice on how to pump and dump, right? Like everyone has advice. This is what I did. This is what I did. Folks come off the the line at different times and have different recommendations on pumping. But, folks would really love some conclusive answers, and people are more than willing to be a part of research that helps build these answers. So it is really exciting to do this research. Also, as Dr. Jung mentioned, reproductive health concerns in general for the fire service are very understudied. There's little that we know about the impact on child, offspring health of firefighters, and there's not a lot that we know about occupational exposures, so how that impacts the firefighter and their reproductive health specifically. Some of the concerns are, chemical, biological, radiologic exposures. Shift schedule, I mentioned a little bit earlier, can impact your hormones, which can impact conception and fertility. The extreme physiologic strain and high ambient temperatures of firefighting, and noise also can impact reproductive health and your body's ability to conceive. So there are a number of different chemicals that can impact reproductive health, and there's a number of different chemicals that are hiding in that environment that firefighters go into, whether that's found in the smoke or in the products of combustion, the things that are burning, right? And that constantly changes over time because the materials of the things that burn, the materials that are in our houses, our furniture, our clothing, those are constantly changing as well. So this research, the studies that we continue to do are so important to continue to identify what's burning. And then we need to figure out how these chemicals react as far as impacting reproductive health. So Alesia mentioned that they study PBDEs, and I wanted to point out that the IARC, the International Agency on Research in Cancer, just identified firefighting as a hazardous occupation that is potentially cancer causing to humans. And so, in fact, they classified it as carcinogenic to humans. There's enough evidence to suggest that firefighting as an occupation is carcinogenic to humans. So it's just important to think about the impacts of firefighting in general on firefighter health and think about how that can impact reproductive health as well as our offspring. So a little bit of work from Sarah and the team. Recent research showed that miscarriage rates among female firefighters were at least 2.3 times higher than the national average. And as Alesia mentioned earlier, preterm birth was found to be higher among female firefighters as well. So this is interesting. We asked folks when they reported their pregnancy to the department. We found on average women reported their pregnancy around the end of their first trimester. And we found that about 71% of the sample, so the majority, reported restricting their duties. So either going on light duty or coming off the line, the firefighting line. They reported doing this around the first or second trimester. But we did find that 22% reported they didn't restrict their duties at all, which is interesting considering what Alesia said about how deciding when to come off the line can impact some of the reproductive health outcomes. And when we looked at when miscarriages occurred or when preterm labor occurred based on when women decided to come off the line, that can be a factor as there are so much going on developmentally within the fetus as far as the first, second, and third trimester. Then we asked when you restricted work, who ultimately made that decision? And 54% reported the doctor made the decision, 42% reported the department, and 46% reported self, or they self-imposed the work restriction. We didn't go into more detail than that as far as asking them when, why, how work was restricted. So of course we advocate that the woman should always be the one to ultimately make that decision, but that this is the way that they answered the question, was who restricted their duties. So, okay, so we asked two very important questions of women in our survey. We had over 1,000 respondents, and so we asked two questions. One was, does your department have any policies related to pregnancy? So the very top line here, I don't know if you guys can see my mouse, but the very top line there, it's in bold, that's overall responses. And then we have them categorized below by volunteer, career, and then structural and wildland woolly firefighters. So overall, about 63% of the sample said yes, they have policies related to pregnancy, so pregnancy policies in their department. What's concerning is nearly 30% said no, they did not have any policies related to pregnancy. And this is in 2017, guys. So this is a recent survey. And then 8% reported that they did not know if they had pregnancy policies. And I've talked about this in the past. Part of that, I don't know, is not necessarily reflective of the department. It may be that that woman was not interested in having children. Perhaps she had children before she joined the fire department. So there's a number of reasons why folks just aren't aware of certain policies in the department. But you can see how much this varies, right? When we look at volunteers, only 31% of our volunteers reported that they had pregnancy policies, whereas 63% of the sample overall, or if you look at career firefighters, 69% reported they had policies in place. Structural firefighters, 56% reported yes, they had policies, and then wildland WUI firefighters, 78% reported that yes, they had policies. So that is related specifically to pregnancy. Now, we also asked if departments had policies related to maternity leave. So when we asked about leave, overall, 68% of firefighters reported that they did, in fact, have policies related to leave. But, again, concerning that over a quarter of departments said no, they don't have any policies related to maternity leave. And what we've found is often women who are pregnant in their fire department are raising their hand saying, yep, I'm the first one. So because it's me, I'm now pregnant as a firefighter and I'm helping write some of this policy. So it can be quite daunting for folks, which is why this education and this research is so important. And again, you can see that it varies by volunteer, career, structural, and wildland WUI. So while 68% reported they had maternal leave policies overall, of volunteer firefighters, only 33 reported that they had maternity leave policies. So it varies quite a bit by the type of firefighting. So we mentioned policies, right? And like I said, it's concerning that more than a quarter of departments reported not having pregnancy policies. It's really important for education for both genders on reproductive health, if nothing more than so that people can make educated decisions, men and women, about trying to conceive. And then once the woman knows she's pregnant, being able to make responsible decisions about when she wants to come off the line, and all kinds of different things. So there absolutely also needs to be more research on the key risk factors and birth outcomes in order to direct both policy and practice. Now, NFPA 1582, the 2022 edition, so it's fresh out, and it is so exciting because pregnancy, reproductive health, and child outcomes has made it into the standard itself and is not only in the annex. So you'll look in section 9, and we'll talk about it on the next slide, but that shows, I think, some progress in fire departments, as well as, pointing to more research necessary. So let's take a look at what section 9 has. Fire departments shall make educational materials outlining the risk from firefighting on reproductive health available to all male and female firefighters. Fantastic. But then where does the department get this educational material and what should it consist of? One good thing is that this is what the standard says that's on this slide here. But there is in Annex C, there is a whole host of information from different validated research sources, and it lists a number of different reproductive health things that are related to adverse reproductive health consequences. So some of the things we talked about earlier, chemicals to be aware of, heat exposure, noise exposure, physical work, bending and crouching, how all of those things can impact reproductive health, conception, and fertility. So it is really important to go and look in that annex if you want more information. But I think overall it can be a bit overwhelming for fire departments to know what type of education they should provide to their firefighters. Also, Section 9, 12.2.2 states if the member requests an alternative duty assignment in an environment deemed safe for the pregnancy and the fetus, the physician shall provide appropriate restrictions for essential job tasks 1, 3, 5, 6, 7, and 8 that would be otherwise unsafe for the member or the fetus. So you are absolutely allowed to ask for alternative or light duty. Different departments have different policies, but you absolutely should not only refer to NFPA, but also refer to your state and local legislation, as well as there's federal legislation that protects your right to ask for light duty, as well as that protects your right to leave if you need leave due to pregnancy. And then, of course, as with any other member, when performance due to medical issues is of concern, the AHJ shall inform the fire department physician, and a medical evaluation would be performed to determine the need for restricting the member from activities that they're no longer able to perform. So obviously, you can't move as well in your gear as you get to full term, and so that may also impact your ability to do the job. Now, again, there are a number of different considerations. Every pregnancy is different, and so it's really important, I think, for the woman to work with her OBGYN, as well as the fire department physician regarding risks. It's important for the woman to communicate her job as a firefighter. Unfortunately, I think the onus is still on the woman firefighter to express to her doctor what she does and what that really means to be a firefighter. Because I don't know that sometimes they understand or really appreciate the physical hazards of the job. So it's important as the woman firefighter to advocate for yourself and explain how dangerous your job is to your physician, so that everybody collectively can make smart decisions and things that you feel comfortable with for how long you want to stay on the line, and make sure that your department is supportive of that as well. So speaking about policy, so even when policies are in place, there was a case in Florida, I think this was 2018, where a Florida firefighter got pregnant and requested light duty, and her department referred to policies that were recently put in place through their collective bargaining agreement. And their policy read that unless the injury occurred on duty, it wasn't covered by workers' compensation, meaning that the department wouldn't allow her to have an alternative or light duty assignment. So I have to also say that after this news story broke, it looks really bad, but I think there were some miscommunications, and the union president said that, pregnancy was definitely part of the discussion and it didn't get written into the standard in the way that they thought that it would. So I say all this to say it's really important to pay attention to your collective bargaining agreements. Even if you don't have a woman in the department who's pregnant at the time that you're writing this, write with this in mind and think about all these things, right, as you go into policies and planning. It's so important. You don't want to end up in the news with a case like this. And it sounds like from their discussions that they really did try to have that in their minds, and somehow it got written into a policy in a way that really didn't work out. So just lots of things going on. So I mentioned earlier that we're going to talk about men just a little bit. I think this is cutting edge research that is going to be some of our next steps. So there was a study out of Denmark, and they examined firefighter fertility compared to office workers. So any other government employee that is not in like a dangerous civil occupation such as firefighting or EMS. And they found that firefighters were 46% more likely to have issues with infertility compared to traditional government workers. So men, firefighters, are absolutely at an increased risk for being infertile or for contributing to infertility in a couple's conquest to conceive. So I think it's really important to look both at men and women and understand that there's reproductive health outcomes for both. We pulled a couple different studies. Again, this one's from the Danish study I just mentioned that showed male factor infertility was anywhere from 46 to 53% increased for male firefighters. Also, paternal employment as a firefighter has been shown to be associated with adverse health effects of offspring. So even if it doesn't impact your ability to conceive, it may impact the health of your offspring. Also, semen parameters like volume, concentration, motility, and total sperm count were lower among firefighters compared to the general population. And increased fire exposure showed a marked reduction in sperm parameters. So the more fire calls you ran, the lower male firefighters' sperm parameters were. So definitely men are impacted as well. So you ask, where is the education in all this? And this is a flyer that we recently produced as part of a collaboration project we're doing with Women in Fire. And our wonderful graphic designer, Jeannie Barnhill, put this together. We collaborated to find research that we had done, as well as research that other groups had done, to put these things together so that this is kind of a flyer similar to the physician's guide for firefighters to help guide your annual physical. This can help guide your conversations with your OBGYN if you're considering getting pregnant, if you are pregnant, and you want to know like what some of your limitations are, what are some of the dangers of the job of firefighting, this guide should be able to help. And there is a QR code on your screen. You can scan that with your phone and it will take you directly to this guide on our site on the Science Alliance. You can download it. If you don't get it, we are more than happy to share this flyer, whether it's via PDF, we can send you the link, we can send you the QR code, but we're more than happy to share this, and feel free to share it with your friends and colleagues as well. I just think it's really, really important information to get out there. So I'll stop here and just share my email address is on the screen, as well as a shameless plug. I have a COVID perception study ongoing. Please scan that QR code and feel free to follow up. You'll complete a brief survey, and if you qualify, we would love to do an interview to find out more about your perceptions of protective strategies such as masking and vaccination during the COVID pandemic. And of course, lastly, I have to put in a plug for the Science Alliance, which is hosting wonderful grand rounds. We're doing a ton of other stuff, and that Kepra mentioned at the beginning of this session. If you're not currently a member of the Science Alliance, scan the QR code on your screen, use code GRANDROUNDS for a 1-year free membership to the Science Alliance. We can't wait to have you on board. And with that, I will stop sharing and see if we have any questions. But thank you guys so, so much for having us on today.
Judith has a question. And Judith, if you could type it into the Q&A, that would be awesome, please. Oh, there we go. Perfect. I'm trying to figure out where it is.
She said it was answered with a smiley face, so I feel
okay. Now I see it. Sorry, it just populated. Okay, good news. Way to go, Brett. I'm so glad you got it all. Judith, thanks for the question. Does anybody else have anything that they want to add, or any questions that they have that they're interested in getting answered? And one thing that that I want to kind of throw out there is that our plan during our health and wellness project in January is that we will have a policy summit. And so part of our goal is to have some working groups. I think that all too often we go to conferences and we get to hear some amazing speakers, but we don't have time to get all of our personal questions answered, which is a big portion of what our goal is during the Science Alliance as well. But this is an opportunity for us to do that in person. And so we are going to have some roundtables. One of them is going to be a policy summit on female policies and female health and wellness. And so if you have questions, please don't hesitate to reach out, because if you have questions now, that might be something that we can bring to the table to help out other departments that if you can't attend. So please don't ever hesitate. Everybody's contact information was on the slides. You can also send us messages through the Science Alliance webpage. So please don't hesitate to reach out if you have some information or questions. Thank you guys so much. Those presentations were awesome. We appreciate you both being here, and we look forward to many more opportunities to hear great things from both of you.
Thanks, everybody.
Enjoy your Friday and your weekend.
Yeah. Have a great weekend.
Thanks.
Happy Friday.